Good evening, everyone present here. I welcome all the participant doctors on today's session. As for today's session panel discussion, the topic is impact of violence on doctors in day-to-day clinic practice on the eve of National Doctors Day. Before starting this panel discussion, let me tell you overview of the topic. And the overview of the topic is violence against doctors in clinical practice has a profound effect, leading to physical injuries, psychological distress, and a decline in the quality of patient care. The fear of violence creates a hostile work environment, hindering effective communication and contributing to culture of fear and distrust within the healthcare setting. To know more about this topic, we have today's moderator who is going to moderate this session. I would like to welcome the sir and hand over this session to sir. And the sir is Dr. R.N. Chhabra sir. Sir is the director of Chhabra Medical Center, Pitapura, Delhi Max, and Shalimar Bagh and Saroj Super Specialty Hospital, New Delhi. I would like to invite sir and hand over this session to uh, invite tell about all the panelists. Over to you, sir. Kindly proceed from here.
Thank you, Mr. Parag, for the kind words. First of all, I would like to thank you, IJCP, MedTalk, for giving the opportunity. Especially thank to Mr. Parag and the Nishitika Mukherjee. So, as Mr. Parag told about the violence against the doctor is increasing day by day. Today, first of all, I would like to introduce my panelist today. First panelist, Dr. Praveen Bhatia. Dr. Praveen Bhatia, Senior Consultant Physician with special interest in the internist and diabetologist and Medical Director of the Bhatia Hospital. And he worked formerly at the Sir Gangaram Hospital as the ICU in charge and Dr. RML Hospital. Worked as a researcher fellow with the ICMR, membership of the IMA, MACP, and FACE, MAPI, and Jocelyn. And he attended various domestic as well as the international conferences, both as a delegate as a faculty. He delivered various public and the CME lectures, and he past executive honorary general joint secretary of the IMA DNZ, and presently he is executive member of the North Delhi Physician Forum. Presently, he is running his own setup at the name of the Bhatia Hospital, main GT Canal Road, Delhi, since 2000. And at present, he is a senior vice president, president of the Indian Medical Association, DNZ. Another is Dr. Sandeep Miglani. He is a senior management course of the health management, IMA, Ahmedabad, and fellow Indian College of Physicians and medical student of the Sardar Vallabhbhai Patel Hospital. And he formerly as the additional director, hospital coordinator in charge in Delhi State Hepatitis Program, and first appellate authority, RTI Act and the 2005, and the DGHS Delhi headquarters. He was the additional CDMO and the CDMO North and Northwest District and ex-medical student after the St. Jain Hospital, Acharya Bhikshu Hospital, and the NC Joshi Hospital. And he was CCMO and the dialysis ICU in charge at LJB Hospital, Jeepant Hospital, and the Muranajas Medical College and the hospital. And he was CMO and the HOD medicine in charge, cardiac and the diabetic clinic, Sanjay Gandhi Hospital. And he was the WHO fellow, cardiology, AIMS, Delhi. And he was expert committee member, Bureau of the Indian Standard. And he was senior CMO and HOD medicine in charge, cardiac, diabetic clinical medical board, and the Aruna Asif Ali Hospital, and member of the State Human Organ Transplant Committee. And he was additional director member, State Antibiotic Policy with the WHO, member of the API and the RSDI, IMA, and General Secretary of the North Delhi Physician Forum, and registrar PGI Rohtak, Hematology and the Nephrology. The third one is Dr. Rohan. He is a very dynamic chairman and the past national president of the Federation of the All India Medical Association. It is a association of the medical residents all over the India, and founder director of the Dr. Rohan Krishnan Healthcare and the Educational Institute. And he is well-known medico-social activist, and he worked as a ex-president of the Resident Doctor Association or the PGI work, and he was president of the Students Union of the Rajiv Gandhi University of the Karnataka, and on the health form he had done more than 25 shows. Another is a special invitee panelist. He Dr. Gaurav Agarwal. He is a HOD and forensic medicine at the Venkateshwar Institute of the Medical Science, and major achievement of work at the 6 medical colleges in the past 22 years, and visiting faculty at CBI Academy, Ghaziabad, and Shadra, Bar Council, Delhi. And he is an advocate also. He is a doctor as well as the consultant physician and the medical legal consultant also. And national coordinator of the IMA headquarters, UNICEF, Ministry of the Women and the Health Child, and development of project of the training of the medical officers on the examination of the victim of the sexual abuse, and author of the LCVR of the PGI medical entrance book series, and contributed to the chapters in the legal medicine in the several books, and published his 5 scientific papers in the national and international journal, and regular speaker at the national platform in the field of the legal medicine, Consumer Protection Act, safe medical practice among the Doctors Medical Council, inquiry cases, and CBI Academy and Delhi Police Bar Council of Delhi, and he conferred with the Delhi Medical Association Vishisht Chikitsak Ratan Award in the 2019. He is a very helpful in the cases with the doctors. He always helpful, and he is a very humble person, and by nature he is Dr. Gaurav. So now I will start our topic. So this is my disclaimer. This presentation is exclusively for the education and the motivational purpose. There is no conflict to the interest of any intention toward anyone in person, entity, government, media, or the association or the organization. In fact, it is an observational and the evidence-based presentation. So first of all, assault on the doctor was almost nil in the both sector, either in the private or in the government, when our profession was considered as a noble one. When there was no political interference in the healthcare system, nowadays so many interference. Another, when there was no Google Baba or the advice or the guidance at that time, it was so the violence almost nil. When there was no businessman or the corporate involvement or the interference in the healthcare system, and no consumer protection before the 80s, CPA or the CEA in the healthcare system, and people were satisfied with the available or the provided treatment offered to them with the available resources and the infrastructure. So bureaucrats and the politicians, what they made, the very sad reality of the doctors, all the load given to the doctors and IS and all the bureaucrats and the politicians slipped from this load. And as of today, burden of the doctors, the heaviest burden that they carry are the thoughts in their head, like this they are carrying on their head. In their head. So as of today, doctor safety, what the doctor safety give to the patient, this type the patient provided by the doctor, the patient safety given by the doctors, but in reverse, the disease safety provided to the public. They always create the nuisance and the violence of the to the doctors. And what is the impact assault on the doctors? If there is a definitely assault on the doctor, what will happen? What will happen to the doctor? You see, there is a personal. What will happen to personal on the doctor? There is a broken relationship in the doctors, and alcohol and the substance abuse. The doctors are abused to the alcohol or the drug abuse, and they will go to the depression. Ultimately, what will happen? You have seen so many doctors are. हेलो फराज, ये बीच में डिस्टर्बेंस का क्या है? मिस्टर फराज?
Yes, sir. वो डॉक्टर सर की तरफ से था. I have muted him.
अच्छा, okay. Recent doctor committed suicide. The recent example you have seen, the late Dr. Archana Sharma. What will happen professionally? There will be a decreased quality of the care and increase the medical error. The chances of the medical error will be more if they are under the depression, and decrease the patient satisfaction. Doctor cannot satisfy the patient. This will happen. Impact of the assault or the violence and decrease the productivity and the professional efforts. That will also decrease. And in spite of that, so many their doctors are facing the assault and the violence. Especially you have seen in the COVID era, doctors are the warrior. They called the COVID warrior. And what a great picture which show that doctor is trying to save the life by not caring about his or her life. Salute to the painter from our heart. So you see, if you go all over the India, but the mortality was much more. In more than 2,500 doctors COVID martyr in this era, despite they never thought about the life of their own. What will happen? This is the news. How India treats the physician, the public treats the physician. The patient is dead, then let us beat the doctor and go home. This is the scenario. This is the times of the India, Sunday, 7th August 2022. So we should take this issue very serious. So the assault on the doctor becomes the disease, just like a COVID-19. It becomes the pandemic, just like a COVID-19. If you steep rise in the assault on the doctors, that hampers the healthcare system. So time to act, now or never. It's a time to act. So what is the management? The disease, we find out the etiology, cause of the disease, diagnosis, investigation, treatment, and the treatment of the complication. So this is the cause, lack of the proper awareness and the disease, and the lack. I will take one by one. First, I will take lack of the proper awareness of the disease and high-tech treatment expectation by the public. What if you, by the survey, if you ask the patient, what is your expectation from the treatment? They will say only well-equipped and the high-rated or the high-tech hospital. Everyone expect the advanced or the high-tech treatment, either free of the cost or the charitable base with the help of the government, data or the trustee. So in fact, it is not possible at all. If we cannot deliver it, then it will lead to one dialogue only, doctors lutere hai. This is the only dialogue by the patient or the public. So that will lead to the assault of the doctor, especially on the resident doctor front line, because they come in the front line. The young doctors are always beaten in the hospital. So another, if the people don't get the free treatment or the charitable treatment, what will happen? The consequences, they will assault the healthcare provider, especially the resident doctor, in the anger and take the kanun or the law in the hands. They will just like this. Discriminate the violence or the assault just like this. They do the assault on the healthcare provider, especially on the doctor. So have you thought about this? Who are the sufferer? Only doctors, patient, and their relatives, along with the taxpayer, because they are giving the tax to the hospitals. So today we will discuss the impact of the violence against the doctor in the clinical practice. I will ask the question to Dr. Bhatia. Lack of the proper awareness and the disease, high-tech treatment expectation by the public and the people. Dr. Bhatia, what is your opinion or the view?
Very good evening, friends. Before I answer this question, I wish a very happy Doctors' Day to all my colleagues. And your question is awareness. Awareness literally basically means having the understanding of the disease. What is the etiology? What are the causes? What it can cause? And how the complications can be avoided. If awareness sometimes can be tailor-made, person to person, doctor to patient, doctor to tenants, and sometimes it is public awareness. On this, public awareness means educating the public how to avoid the diseases, how to face the complications. With this, I would like to give one example of late Padam Shri Dr. K.K. Agarwal. At the beginning of the COVID pandemic, when it started, he relayed a video basically was posted on the YouTube that how to keep your hands sanitized. At least through COVID, we have learned to keep our hands to sanitize and to clean regularly. That's public awareness basically. Similarly, public awareness programs can be on the alcohol, on the addictions, on the vaccinations, or various pandemics. Public awareness can be there. And public can be educated regarding how to avoid the diseases and how to face the complications. If complication is there, what to do in that condition. Regarding this, you are very right. Awareness is very important, Dr. Chabra. You all will agree. Basically, in last few decades, we have seen that there's a lot of development in the techniques. Nowadays, we're having robotic surgeries, we're having artificial intelligence, we're having techniques of AR, and we are having nanorobotics technology also. But the only thing is all these techniques cost money. We need special staff, we need special minds, we need training of the staff, and everything requires money. One cannot think of eating at 5 star at the cost of dhaba, basically. What happens basically, I will just like one example in Rajasthan, what happened. Public was taught, basically education was given that you can go to the hospitals and get the treatment free of cost. But friends, the thing to be thought of is very important, that things are not available free of cost, it costs money. So it's the responsibility of the state, and through this media, through this platform, if my voice can go to the government must also think that things do cost money and cannot be provided free of cost. If public is motivated to go to the hospitals and get the free treatment, it creates a gap between the expectation and the delivery. Things which we cannot deliver, but the patient is expecting. And if this gap is created, definitely it will lead to violence. Yes, Dr. Chabda. I will come back to you.
Nicely said. You mean the cost is very, very important factor in the violence.
Yes.
If the patient gets the mobile, then definitely there is a violence or there is some assault with the doctor.
There will be a gap between the delivery and the expectation. The violence is bound to be there.
Okay. Okay. So next, we'll, the lack of the coordination for the management of the disease among the government, medical fraternity, IMA, public and the doctors. There is lack of the coordination. You have seen, as we have seen the management in the COVID pandemic graph. What is it? What we need to learn from this graph? You see the webinar and the corona cases increasing as the corona cases, but the earning of everybody goes down or almost nil in this era. But bureaucrats and the officials are missing from this management graph. They are not accountable at all. What will happen? Why? Because they are not accountable and getting the full salary. There is no cut in the salary of their, they're getting the full salary, but they are not accountable at all. So, but the managing the show with the zero knowledge of the COVID-19. You have seen everybody is giving the jam of the COVID era, which means ye karo, the bureaucrat or politician or any give the knowledge to the COVID era. But medical fraternity is helpless due to the dominancy of the non-medical, because always they dominate the medical. So what will happen? The question to my Sandeep Miglani, what is the lack of the coordination, the management of the disease among the government, medical fraternity, IMA, public doctors? And what are your views about this? Dr. Miglani.
Yes, good evening, everybody. Basically, the issue between between the expectations and the comparison. Like 30 years back, the government hospital were the only hospital who were treating the patient, and private sector has grew very largely. Like infrastructure has grown up, but in the government setup, like MRI, CT, and radiological investigation, imaging, or super specialty, there is even if you say, then in Delhi, Maulana Azad Medical College does not have a DM courses in nephrology, the critical care, and in emergency medicine. So because of that expectation and lack of infrastructure and less government spending on GDP, we are spending less. So people 30 years back, when you used to visit the government hospital, they have the expectation that this is the only place where they will be treated. And the chances of violence was very less because this was the last hope for them. Nowadays, they don't have the money, but they compare with the private hospital, corporate hospital, and they are not able to spend. They expect the same thing in the government hospital. And government hospitals are not so equipped to treat such type of patient, critical care patient. And another, the salary structure, like radiologists, critical care specialists, anesthesia, we are not getting these type of specialists, even senior resident in these very specialties. So what to talk about the specialists? Because of this vicious circle of expectation, lack of infrastructure, and the senior person support also. We senior person are also at fault at some places, because when critical care patient come, the senior person know that he will not be able to manage because of lack of infrastructure. And sometimes junior people, they feel let down and they don't get the support. When everybody is there and they are there to treat, then these things will not happen. These things happen because of lack of infrastructure, senior support. And similarly, like if we see the private practice, small nursing home, they are also facing these type of problems. And IMA, DMA cannot support them. Basically, they have to draw a line, what type of patient they should treat in a smaller hospital and what type of the patient they should treat in a bigger corporate hospital. And patient should also be made aware that these are the facilities available at these level of structures, and their expectation should bring down to that very place where such type of facility exists. And that is also important, because political announcement cannot serve the purpose. Like, you may be giving free medicine, you may be giving free X-ray, ultrasound, you may be giving like you may be mohalla clinic or dispensaries, everything free. But critical patient need an infrastructure and a specialist, and which are like for that infrastructure you need money. So GDP spending should also be there. Bureaucrats are not concerned about the GDP spending. They have a very less budget for the health in the government. These type of problems are they are creating a vicious circle basically.
So you mean the infrastructure is very, very important, especially for the critical patient. But the OPD you can see anywhere, but the critical patient, the infrastructure is very, very important. Another coordination. If there is no coordination, then definitely there will be a violence or the assault on the doctor. Am I right, Dr. Bilani?
Yes, yes. Yes, sir, definitely. And bureaucracy, they need to support the doctors.
Yes.
They should pay, they should be ready to pay. Their salary should not be compared with the clerks or the bureaucrats, so that they can get all the specialists in the government hospital.
Even the politicians should support the doctors, the healthcare provider.
Just basically bureaucracy and the politician, only they can increase the budget. And DMA, IMA only can pressurize them that there should be a better facility for the doctors and better infrastructure, and so that people join and infrastructure is better.
Dr. Biglani, if the politician and bureaucrats pacify the patient, then it will be better. I think that will increase and enhance the coordination among the patient and the doctors, I think.
Yes, sir.
Pacify the doctor.
But politician will never admit that the infrastructure is lacking in the hospital. You have to convey that it is lacking. They should improve the infrastructure.
Okay, thank you. Next. So next is the lack of the available resources and the infrastructure. As you have seen, a lack of the available resources and the infrastructure, that is the most important cause of the assault on the doctor. Beds nahi hai, to doctor ko beat do. Oxygen nahi hai, doctor ko beat do. Lack of the manpower, ward boy nahi hai, wo nahi hai, doctor ko beat do. Ambulance nahi hai, doctor ko beat do. This has been seen especially in the COVID management. Every time, even the reception, people were beaten by the public, because if there is no bed, they said there is no bed, they are beaten. Especially doctors have been beaten in this area. So I will ask Dr. Rohan. He is a very young dynamic. He has faced so many problems because he was the resident at that time. What is your opinion, Dr. Rohan?
Hello, sir. Good evening, and thank you for the opportunity to Med Talks and Dr. R.M. Chabra, sir, for this a beautiful show covering about the violence among doctors. Obviously, sir, we feel that the infrastructure plays a very pivotal and a big role when it comes to medical care management, because in the past 20 to 30 years, we have seen that medical education and medical treatment has become a lot of dependent upon the available infrastructure, upon the labs, and upon the new techniques of medicine that has come up. So it is very important for us to understand that a big building and a doctor cannot do everything. We need oxygen cylinders, we need ventilatory support, ICU backup, and proper team for a hospital to work properly. But this is where the problem comes. Government, healthcare organizations, everybody thinks that we have the buildings and we can increase the number of beds and we can put beds and that will be more than enough. But we have to understand that during COVID period, that this was one of the major problems that we were facing, that there was no lack of oxygen supply, there was lack of oxygen blood. And for the patients in general who do not understand anything else, they believe that if there is some problem at the treatment at any hospital, the doctors are responsible. They don't think in a way where it might be a problem with the nurses, availability of nurses. It might be a problem with the availability of sterile operation theater, availability of implants, or oxygen cylinder, or ventilatory support, ICU backup. There are thousands of things which are required for a hospital to function properly. But for the patients, it is the doctors who is responsible for everything. And that is where we face the brunt, because infrastructure and all the other necessary facilities that has to be provided is not the job of the doctor who is working in a hospital in a government sector or even in a big corporate sector. It is the responsibility of the hospital authority, the managing committee, to provide proper infrastructures to the doctor. I used to say कि बिना अस्त्र शस्त्र के हम कैसे कोविड में काम कर सकते हैं, जहां पर मास्क की कमी हो रही थी, N95 मास्क की अवेलेबिलिटी डॉक्टर्स के लिए नहीं थी, पीपीई किट की अवेलेबिलिटी डॉक्टर्स के लिए नहीं थी, वैसे में पेशेंट्स का इलाज करना किसी गवर्नमेंट सेक्टर में कितना मुश्किल हो जाता है, ये शब्दों से बयान नहीं किया जा सकता है. तो पेशेंट्स हैव द मेंटालिटी कि इफ समथिंग इज नॉट गोइंग प्रॉपरली इन द हॉस्पिटल, this is the problem, there is some problem with the doctor. And the grievances of the patients are many times real as well. If we were discussing few days back that we get so many parvis for an ICU bed in MAMC or Safdarjung Hospital, and it is almost next to impossible to get an ICU bed. And we were discussing if one day we ourselves require a bed, it will be difficult for us to arrange a bed for ourselves. And one of our representatives during COVID was not getting oxygen bed, which became a highlight, a big news at that time. So it is a truth that there is lack of infrastructure, especially in the government sector. We are building a lot of buildings and hoping that this will work as a medical college. I have seen many hospitals in Delhi with a huge building but lack of basic infrastructure as well. And at the end of the day, the patient thinks that the doctor is not doing proper treatment, where the government has made such a huge building and the treatment is not happening. So whatever is the basic requirement for any department to run, be it nephrology, be it cardiology, orthopedics, neurosurgery, for any department to run properly, there are some basic infrastructure which is to be provided by the authority, which is at the end of the day, the health secretaries and ministries, because doctors are not right now working and telling that this much beds are required, this much oxygen cylinders are required, and they are getting it. It is not happening like that. There is a proper channel which is being controlled completely by the health ministries and the secretaries, where doctors have no role in it. And this, the patients do not understand. So we do face the brunt of it.
Thank you, Dr. Rahan. Can you tell me your experience when you were on the duty on the COVID?
Yeah, yes, sir. Once what happened when I was one of the working as a medical officer in the COVID duty in PGI. Actually, that was a scenario that is quite traumatic and emotional to me as well, because in my entire career, I have never seen around 10 to 20 patients dying in 6 hours of duty. So that was something which was very traumatic to me. And the chamber where we used to sit and hang out, that was all filled by dead bodies, where few dead bodies the relatives were not willing to claim as well. They were hesitant to claim the dead bodies of their known people. And at that time, a few of the people came and asked that we need remdesivir injection, because that time remdesivir was having a big peak that it can help in COVID or something. So at that time, we were not being provided remdesivir injection. One of the patient's relatives were very sick. Some of the doctors from the outside told them that remdesivir is a magical drug and it is helping. They asked us to provide remdesivir. It was not my responsibility to provide remdesivir. It was I had no role in planning of the COVID management. I was just a doctor doing my duty, ignoring my senior citizen parents and infant child, thinking that they don't get the disease. So we were living alone in different hostel and different blocks. So at that time, it was pretty traumatic to me, because they were actually literally fighting with us that you provide us. We know that doctors have everything, but they are not giving to the patient. They are keeping for their families. So that kind of mentality was there. At that time, I thought that the government should actually come up with some idea stating that remdesivir is not the drug of choice, or stating that we are not available, that is not available at the hospital. Similar was the case going on in Hindu Rao Hospital regarding the oxygen bed.
Yeah.
There was lack of oxygen beds. The patients thrashed one of the doctors to give them oxygen beds. So the patient think that it is the fault of the doctor, and because they are having some kind of, they will give to someone who has more parvi, who has more political approach, which is 99.99%, which is completely incorrect, because all of us, we try to do the best to the patient, which is in our hand. But mostly there are lack of infrastructure, there are lack of manpower. We are exhausted in 36 hours of duty. There are lack of doctors as well. So there are lack of proper sanitary toilets, the doctor's room. So there is a big circle which is involving the patient care in India, and that has to be focused upon.
Yeah. Around very lightly said everything, but it means आपको ऐसा हो गया कि आपको बिना हथियार के युद्ध में भेज रहे हैं. If there is no infrastructure, no equipment, it means you are going to the war without weapon. That is the only problem.
Exactly.
It is very, very important. So next cause of the violence, I will discuss the imbalance in the law and ethics. Very, very important. So dear friends, law and ethics are just opposite. One is ethics and the legal point. As per the law and ethics, we are always confused whether we are right or the wrong. So ethics is a set of the moral principles and the code of the behavior that govern an individual's action with the other individuals within the society. And law are the societal rules and regulations that are obligatory to observe, and law have governed the practice of the medicine for over 100 of the years. And combination of the law and ethics, there is a national medical combination, Medical Council of India, it was previously known as, and other state councils. So there are 72 rules, 72 law and regulation. That is the Baburaj, and all breeds either corruption or chances of the medical error. And ultimately, they will lead to the either violence or the assault on the doctor. So always sword hanging on the doctors if they are working in the hospital. So how can a medical fraternity, especially the doctors, work under the under regulation or the over regulation? Plethora of the laws and regulation, 72 laws. So it is always questionable and difficult to answer. So my question to Dr. Gaurav Agarwal, imbalance in the law and ethics, what are your views about this point? Dr. Gaurav, please. Unmute करिए. Dr. Gaurav, unmute कर लीजिए.
Yeah, I'm sorry. Thank you, Dr. Chabra, for the humble invitation. And as far as the question is concerned, see, you rightly set the stage right by mentioning that we are under the pressure of so many laws, 72 to be precise. And, you know, if you trace from the point of 19, when the first Indian Medical Council Act came in 1956, and although it has been revised by the NMC Act now, every 3 years there has been a new law only for doctors. I'm not talking the Constitution and all other laws. They've been amended. The Constitution amended more than 100 times now since independence. And Indian legal system happens to be the largest legal system in the world. As far as doctors are concerned, not only, you know, we've been not only in Delhi, but all over the country, we have been under the pressure of earlier the waste management. Now the Solid Waste Management Act has come in, the rules have come in, and now they're demanding prices from us to the tune of almost 25 for 1,000 rupees per annum in the state of Delhi, which is 4 times more than the price they are demanding for collection of garbage from premises from restaurants and dhabas. Major flaws in law. But anyway, my views are that under the pressure of so many laws, the medical establishment, be it single doctor clinics or nursing homes or even corporates, okay, they have a huge infrastructure, they've got money and everything, they can employ people to renew these laws. Most of these laws require renewal after a period of every few years, but smaller nursing homes and single doctor clinics cannot do that. The second issue is, as far as the imbalance between ethics and laws, which is leading to violence, is that lack of awareness of laws that can protect doctors among doctors. What happens is that we've got, even if we don't talk about the 20 states in India that have got special laws meant to protect doctors, the other states we are talking about international law, fair enough. Even if this law was not available, there are enough provisions in the Indian Penal Code that can prosecute the offenders of violence at the medical establishment. But now this Medicare Act is a very, very powerful act over and above the Indian Penal Code. And even above that, whenever there is an issue of medical negligence, violence happens, and sometimes the issue of arresting doctors comes by the police. There is a very powerful weapon again given by the Supreme Court in the form of Jacob Matthew's judgment, which prevents arrest of a doctor without inquiry. And the arrest, after that, the arrest has become much less. But even then, there is misuse of this law. People say, police says, we do not know. The weakest part that I'm trying to highlight over here is the implementation by the concerned authorities. The implementation, there is lack of will by the politicians. There is lack of will by the police enforcement agencies. There lack of the entire media is always against the doctors. So the issue is that this lack of implementation is mostly responsible of violence against doctors. I'll give you a very simple example. In the state of Rajasthan, and not only Rajasthan but many other places, there is a new concept that has come in, although it was there earlier as well, but now it has become popular, something called as Mautana. Mautana is an amount of money when a patient dies in a medical establishment demanded from the relatives of a deceased patient from the owner of the medical establishment. Now that amount could be anywhere between 10 lakhs to 50 lakhs or even crore. You give us this money, we'll take the dead body. Only then we will take the dead body from the medical establishment to perform the last rites. 3 days ago, an incident happened in one of the districts in Churu, if I'm not wrong, in Rajasthan. So the need of the day over here is that all the doctor fraternity get together, and they did get together, and only then the matter was diffused by the police. The police force was there. They were unable to convince the relatives to take the dead body to perform the last rites and maybe to shift it to the mortuary. So when the entire doctors fraternity got collected, including the IMA and all other Upchar association, then only the matter was diffused. The point that I'm trying to make is that imbalance will remain unless the implementation of the existing laws is made in the true letter and spirit by the police, the enforcement agency, the police, and the politicians having their will supporting them. Dr. Chabra?
Thank you. Thank you. Rightly said, Dr. Gaurav. Definitely awareness, you require awareness. Even doctors and the police, and nobody knows about the rules, what is the legal and rules, law and regulation in the medical fraternity if there is a fault. Most of the people are not knowing. Even the doctors don't know. Even the Thana Prabharis don't know about this thing. So next I will come to the next point. Media involvement. You see, same picture, media will show with a different view. There is an accident in the, there is a false, there is no accident. The same view, with a different view, they show a picture. This is the media. So media, you have seen the negative approach of the media कुछ चैनल दिखा रहे थे, पेपर में बता सकते हो, चिताएं, हॉस्पिटल भरे हुए, परिजन परेशान, महामारी, हमें सब पता है, महामारी है, हमें पता है, आउट ऑफ कंट्रोल है, कोविड सबको पता है, लेकिन नेगेटिव अप्रोच creates the unrest and the unseen fear among the public. Healthcare provider leads to violence and the assault. So I will ask the Dr. Praveen Bhatia, what is your views about the media involvement in the healthcare system?
Yes,
Dr. Bhatia, please.
Very right, Dr. Chavda. Basically, media is simply a mode of communication between two group of persons, from person to person, or group of persons, basically. And media, I was going through some article around about in last 20 years, media has come in our life. It has increased by 80%. So how much important media is nowadays? So now we can divide the media into maybe the broadcast media, or it is magazines or newspapers, written media. So media is very important, but whether it is a positive media or a negative media, but ideally it should be a positive media. Positive media, I mean to say, is public health education programs can be there on the media. One can convey the communications regarding the pandemics. One can interact with each other. Doctors can interact with each other, like right now we are doing. We are using the media in this particular way on this platform. This can be used in positive media. But the negative aspect of the media is that sometimes wrong information or lack of information or poor quality information is given on the media, as has been commented by one of my friends right now on the platform, Dr. Rohan. He talked about remdesivir. I know at that time, any patient having fever was directly going to chemist shop and demanding for the injection remdesivir, although it was not required. At the same time, at the time of pandemic, celebrities who were sufficient with the primary care were using the tertiary care hospital beds. They were utilizing the bed capacity in the improper way. I won't name any person, but we all know by the media. So media has to be used in the proper way. If used, then it can be of use for all of us.
Yes.
At this time, through this platform, again, the message which I want to convey is there has to be some autonomous body. Somebody has to be there which regulates the media. Media regulation is very important. It has to be guarded. It has to be censored, and the wrong information, inappropriate information should not be given. And political privacy, professional privacy and patient privacy has to be maintained, which is not being maintained because of the media. I'm not saying every media is wrong. There are few good media also. In the case of Dr. Archana Sharma case, media had a very positive role. And as Dr. Gaurav has also said, the Rajasthan story, the attendance patient, diet patient was demanding money. This is really a truth. It means what Dr. Gaurav is saying. I can, if we reciprocate from Dr. Archana Sharma case, I think hopefully it was same thing. They were demanding money. And some media was in favor of doctors. I'm not saying every media. At that time, media was in favor of doctors, and they come out. I won't name any media right now. It is not possible to name, but they were the proactive media was there. So the message to be given right now is media is to be censored. Some autonomous bodies has to be there. Some guidelines, professional guidelines have to be there for the media also. Thank you very much.
Thank you, Dr. Bhatia. I rightly said, major role of the media is there. If they give the positive, then that is beneficial for the healthcare provider. Another bill, especially in the private and the corporate hospital. So you see, अस्पताल में अगर मौत हो गई है, मीडिया में आता है बना फर्जी बिल. So I will ask, have you seen the circulation of the hospital original bill? There was a bill of the 25 lakhs, a share of the doctor only 50,000 or 55,000. So now I will ask the Dr. Sandeep Miglani, what is the role of the bill in the violence? What is your comment in this?
Please repeat, sir. It was not audible.
Pardon?
You are not audible, sir. Please repeat.
Audible? Why? What happened?
No, now you are audible. Please repeat, sir. It was.
What is your opinion? Bill is the cause of the violence?
Yes, definitely. What I am saying is a cause of the violence, because when they go to the corporate hospital without realizing that their treatment in the ICU may take few months or even few weeks or days, and definitely all things come at some particular cost. There is no subsidy. Either government should subsidize with the insurance or other method. Otherwise, patient has to bear the bills, and that with the Indian scenario, the per income per person, per capita income with the per person, I don't think the corporate hospitals are affordable. Even people are not able to afford insurance, especially the elderly one. They cannot buy the insurance. In those very circumstances, government should formulate a policy so that if they want the corporate hospital or in the government hospital, best treatment should be available and then insurance should be there. It should not, doctors should not be penalized. They should not be at threat. It's the government who has to subsidize, and this should be some stage. It will become a national issue, maybe an election issue, just like in USA. Its healthcare bill is definitely a very important issue, and it should be taken care of.
Thank you, Dr. Miglani. Bill is very, very important. If bill is high, then definitely patient will disturb and there will be a chance of the assault of the violence. So another very, very important, I will ask Dr. Rohan. So another is the over expectation of the outcome of the treatment. So everybody wants the over expectation of the treatment. Everyone wants everyone expects the 100% result from the treatment, irrespective of the disease or the stage of the disease. I will ask, and if not met, then lead to the violence of the assault. I will ask Dr. Rohan, what is your opinion?
Yes, it is true that in general, the society has seen a big downfall when it comes to ethical, moral, and social values. Be it if you look at it in any field, I think that right now the society has gone completely down south when it comes to ethical values, moral values, and expectations are something which could be taken in a two-way. One is a positive expectation, that he is the doctor is trying his best, and I think that something positive will happen. And there is a negative kind of expectation where people think that saving life is the duty of the doctor, and it is in the hands of the doctor. There is where the confusion arises, because if you think that okay, my patient is saved because of the doctor, and if he is dead, it is because of the negligence of the doctor. This mentality has evolved over a period of time due to over expectations, due to a lot of Google searching. You just write brain surgery revival patient in Google, and you will have a lot of articles about it, that I did this and we did that. So whenever something or some patients suffer from some injury, for some kind of lethal condition, very serious patients, they go to a doctor with an approach that okay, this is curable, which in fact is not. We can only do our job as per the available resources, infrastructure, knowledge, manpower, etc., etc. At the end of the day, I always speak to all the patients that we are not gods. Nothing is in our hand. What we can do is try the best for the patient, which every single doctor, I must tell you, every single doctor in his profession, from the day one where he joins MBBS, he has that mentality that he will do good to his patients. Otherwise, if you consider an army person, if someone joins an army, for example, it is at most that he wants to do something for the country. Otherwise, why will he join the army? Similarly, if someone joins MBBS course, he is having a motive towards saving lives, towards saving patients. He thinks in that way. But what has happened due to over expectations is that people think that if something has gone south, if something has gone wrong, it is because due to the negligence of the doctor. Otherwise, it was a very easy condition. My Falana, Dhimkana, and someone XYZ had the same disease, and he was saved by the surgeons. So if he is not saved, it is the problem with the surgery. It is the problem with the doctors. If it's a government sector, they blame the doctors and they blame the infrastructure. If it is a private sector, they'll blame the doctors and say that they are looting money. I don't know what we can do to convince this load of patients. There is a chunk of patients and relatives who thinks in that way. For them, social awareness and moral education is also important, in which media and other platform role is pivotal. We are living in a symbiotic society. We are living in a society where everyone can help themselves, and healthcare is not a subject which has to be dealt only with doctor and the patient. There are many other people who have to take a lead role in this. If you blame someone, if some army personnel go to a war, and if they lose and you blame that they were not patriotic enough, I think that this is a taint, and it is a black spot in their character who are thinking like that. It is not a black spot in the army men. Similar is the case with doctors. If you think that the doctors are not doing the best for you, if you're thinking the doctors are looting you, I think that there is something very wrong with the mentality of yours. So this has become the system over a period of time. Everybody thinks that they are smart enough. Everybody thinks that they are educated enough. There are WhatsApp university, there are Instagram universities. Anyone could be defamed in a minute. So we have to think in that way, that whatever is going on has to be stopped, and an awareness at school level, at an awareness at college level to the students is very important, so that India does not go into a society which is shamed by all. Because people, when I talk to my friends in foreign countries, they say that what are you doing there in India? Neither you are getting paid properly, nor you are getting the respect which was there 20 to 30 years back. Then what is left for you in the country?
Dr. Rohan, we cannot give the guarantee at all. Even on the 10%, the 20%, no guarantee can be given after the treatment. So outcome, it depends upon the stage of the disease. Depends. We have to explain the outcome of the disease. So outcome of the treatment. So guarantee cannot be given to any patient. So next, views will be taken from the what is the treatment remedy to stop the check assault on the doctor. So other failure or to achieve the goal or the desirable outcome, one is the transformation of the doctors to the politician, elected office bearer, and the executive member don't justify their role once they are elected, and accept the president, secretary, treasurer, other office bearer are only for the name of the letterhead, and even the president-elect in the every medical association rarely appears throughout the particular year, which is the most important for the learning and the training. So what are our aims and motive of this presentation? As per our past record, everything gets cooled after a few days of the protest, halla-gulla, debate, argument, and the incidents, or the no proper fruitful solution or the outcome, or most of the time creates an unseen problem that further worsening the healthcare services and leads to the more violence. And this time it was seen that the medical association and the medical fraternity came together for the combined efforts for the justice of the late Dr. Archana Sharma to keep our action of the mission live and active till justice, but gradually it has become weakening and almost forgotten. So we must motivate to reactivate till the justice of the Dr. Archana was achieved. And what is the proposed remedy? Combine efforts of the Indian Medical Association and its branches, as it is the largest association of the doctors in India, along with the all medical association. We should pressurize the government, central as the state, at the level of the best to resolve our day-to-day problems or the issues, and ask them we are not on the list whether about any party politics. Indeed, we are concerned about the medical fraternity or the forthcoming generation to whom we are answerable. So proposed remedy at the medical association, only IMA, big and the powerful association for the doctors all over the India, is morally bound to resolve the problem and the issue of its esteemed members of the doctors, along with the support of the other medical associations like API, CSI, RSDI, ASI, BOXI, IMA, and RDA. Though they are the academic oriented association, but they are also bound for their members' welfare. So we must empower the Indian Medical Association for the combined efforts and empower them and strengthen the IMA. So our aim and expectation from our leaders and the association, quality must be in elected or the selected. If unopposed leaders, they must be 3D personality, dynamic, daring, the bung, and at IMA and all medical association level to improve the uplift the loss to the dignity and stop the violence. And IMA and all medical association must combine effort to improve the or the resolve the issue. So proposed remedy at the resident level, how long do we tolerate the violence against the young doctors? Time to act now or never, and propose security protection no pressure or the senior on the junior who are already under the pressure. FIR must be made against the miscreant or the violators, and awareness about the IPC or the punishment, as the Dr. Gaurav was saying, awareness is very, very important. Violence against the doctor must be displayed widely, as the people even in the official are not aware. Just like public awareness poster that was leaked on the 31st October 2021 by Dr. Professor Dr. Anil Guleria, former director of the AIMS, and to aware the people about the consequences. This is the consequences. It's the eye-opener suggestion. If you should say the public, if you assault your doctor, means you are assaulting yourself. It's awareness to the public. Should be displayed in all the clinics, OPD, casualty of the public places, and positive attitude to the media. As Dr. Bhatia was saying, positive attitude to the media will definitely help to regain the lost dignity and uplift the image of the doctor and rebuild the trust and among the public and healthcare provider. Though it is very difficult task, but nothing is impossible in this world. Be positive always. So what do we want? We want the clapping or the drubbing of the thali, candlelight and flower showering. I think everybody in my favor answer big no. We want a central law against the violence of the doctors and the medical establishment, and we want appeal to the people by our Honorable Prime Minister to stop the violence against the doctor in Man Ki Baat program, as it is a very popular program, at least once or if possible, every episode, either at the outset or at the end of the program. So we want the safety at the working place with the zero violence. So take a message, change it, attitude to the harmony among the us, and we work with the available resources. We reside in India. We have to work with the available resources. Nothing can be increased. So dear friends, humble advice, don't wait for the Mr. India who will come to protect you, but do combine efforts and the teamwork with the available resources and the manpower. So what a thought of today in the CPA era, a murderer is innocent till the proved guilty, a doctor is guilty till proved innocent. So dear friends, let us come together to change this proverb or this thought, and we don't want another Dr. Archana Sharma in the future. Thank you very much, and we want the justice for the Archana Sharma. So question and answer session, then I will ask, there is any chat question? Mr. Farad? Mr. Farad?
Yes, sir. I have posted one question from Dr. UC Singh. Why you can check it, sir. Now.
Why medical ethics are not followed? Dr. Gaurav, would you like to answer this question?
Yeah. So my opinion is, first of all, most of us are not aware what are the medical ethics that we are supposed to follow. Right now, as far as law is concerned, the medical ethics applicable to allopathy doctors are the Ethics Regulations 2002. Even if after dissolution of the MCI under the Indian Medical Council Act of 1956 and the new Act of National Medical Commission, it still remains relevant. It still is the law of the land. In fact, there is a Supreme Court judgment, very powerful one, which says that every doctor should have a copy of IMC Regulations 2002 in his chamber and should read it thoroughly. This not only has moral principles, but also legal principles that all allopathic doctors in this country are supposed to follow, and in letter and spirit, and practice it with their patients and in consultation with their colleagues and in interaction with the society at large. So first is that we need to be aware of what are the medical ethics that are applicable to us, and also what action that we are liable to in violation of those medical ethics. So this is my view, sir.
Okay, thank you, Dr. Gaurav. It means ethics, we are, all most of the doctors are ethical, I think. They are following all the
Yes.
ethics. Yeah.
जब तक ethics ही नहीं पता होगा तो हम follow क्या करेंगे? So the
because
first requirement is, yeah.
Law are being changed day by day, and every year it is changed. But the ethics is the old one that is being followed. Hippocrates वो 300 में कहती है ना, Hippocrates ने बाण लगा दिया है वही ethics में. So now I will take there is no question in the Dr. Kumar. How should doctor deal with the mental stress during the non-stop hectic workload? Dr. Bhatia, would you like to answer this question?
Yeah, first of all, I would like to point out is that one should not work without rest. Proper sleep, medically asking minimum 7 hours sleep is must. One should not work like that. One can work in shift hours. Number two, whatever the hobbies of doctor are, he can enjoy his hobbies like music, he can enjoy traveling, he can enjoy. As we know, life is quite tensionful nowadays, and things are very bullish, and one should live his life normally. One should not be too hectic in his schedule. That is my suggestion to all the colleagues and all the doctors.
Okay, thank you. It means doctor है, अगर डॉक्टर ही ठीक नहीं होगा तो पेशेंट को क्या ठीक करेगा?
Yes.
You mean? मेंटल स्ट्रेस में कुछ चाहिए, जैसे हमारे मोबाइल को चार्ज चाहिए, रिचार्ज चाहिए, तो डॉक्टर को भी प्रॉपर लाइट चाहिए, प्रॉपर डाइट चाहिए, प्रॉपर स्लीप चाहिए, प्रॉपर एवरीथिंग शुड बी रिक्वायर्ड फॉर द डॉक्टर बिकॉज डॉक्टर इज आल्सो ह्यूमन बीइंग.
Why to work at the cost of your health or your money? Why to work?
वो कहते हैं ना, your brain is fine, then everything is fine. If your brain is not fine, heart is not fine, everything is not fine. So I will ask the last concluding remark from Dr. Miglani. Would you like to say something? Dr. Miglani, unmute yourself.
Today we have discussed almost everything on this very issue, but we should be like there. I think there was one also question that how should, if you face the problem, how should you handle it? I would like to answer that, like one, that like spending time on the resuscitation. Once you are resuscitating the patient they will not attack you. Secondly, you should call for the help if you fall in these type of the situation. And third, there should be alternative arrangement to transfer the patient. If patient is very sick and your facilities are very lacking, then you should transfer, you should have the facility, or you should make the arrangement of the government ambulance or the cat ambulance so that the patient can be transferred to a reasonable place. And that's all you have covered, because combined effort of all the associations, and we have discussed the solutions also. So I think we should continue to follow all these solutions, problems and solutions continuously so that we can achieve our goal.
Thank you, Dr. One question from the Dr. Suman: how to react and deal with these kind of the situation during the practice? Dr. Bhatia,
The question I could
if
get.
there is violence,
What's the
how
question? How to end the violence, basically. Yes.
Yeah.
My suggestion is that we should have more of harmony among ourselves. We can have associations area-wise, and once there is some physical intimidation or something, if it is expected, then we should inform to our colleagues who are nearby, and if at the time of crisis, they can come to your help. Supposing today, if I am in trouble, next day, जो मेरा पड़ोसी है वो ये सोचे कि उसको ट्रबल नहीं आएगी, उसको भी दिक्कत आ सकती है, तो मेरे को दिक्कत है, मेरे पड़ोसी को मेरे साथ आगे खड़े होना चाहिए. Basically same thing is for everyone. So we should have small associations. Whenever there is this crisis of this type, we should gather together and solve the problem. As Dr. Gaurav has pointed a case regarding Rajasthan, in Churu, Dr. Gaurav, you pointed out, all the associations, all the doctors' colleagues together at one place, and they solve the problem. I think this is the immediate answer is this. We should have more of harmony among ourselves, and we should stand with each other at the time of crisis.
okay. I think Dr. Ron has left because he has a duty at the APM. That's why he left. So, dear friends, if there is no question and enough discussion is there, I would like to thank you, Dr. Bhatia, Dr. Miglani, Dr. Gaurav, Dr. Rohan, and I must thank you myself also. And all thank you to all the audience and my organizer, IJCP, and Mr. Raj and Nichita. All the thank you very much. Thank you. And good night to all the. Thank you very much. Over to Raj.
Thank you so much, sir. It was great pleasure to have all doctors like you, and you have discussed very well on this topic, which is one of the most important topic in these days, sir, because we only focus on the patient like patient should recover and patient should deal with overcome, but we don't focus on the doctors who are the savior for us, right? This is the wonderful topic and very well discussed. We all are proud of you, sir, and all we salute for the work you do, sir, and thanks a lot. And we are very glad to once again on having IJCP group platform MedTalk, sir. Thank you, sir, and hope to see you again with coming time with different topics. It was a wonderful discussion once again, and happy Doctors Day, everyone. Stay safe
Thank
and
you.
stay
Thank you.
secure.
Thank you.
Same to all.